Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Thursday, July 18th, 2024. And our top story today, a study finds that heart valve disease is more common in aging adults. And joining me now to discuss this and a lot more is Professor Vassiliou. He's a cardiologist with University of East Anglia, Norwich Medical School in Britain. Vas, Professor, so great to see you. Thanks so much for joining us on the program this morning.
It's a pleasure to be here. Thank you for the invite.
Yeah, and I want to talk about this research. Again, it's amazing how much research is going on and how much we're learning day to day, year to year about the cardiovascular system and other parts of the body. Let's talk about some basics, though. What is heart valve disease?
Yes, so the heart has four valves, and they open and close in a very predetermined sequence and in sync with each other. And what their aim is to achieve is actually allow the blood to flow through the heart in a one-way system. So the pumping action of the heart, because the heart is effectively the pump that pumps blood around the body, is as effective as it could be. And the valves are there to ensure that the pumps effectively.
And how prevalent, when you look at the general population, and again, knowing that you're in Cambridge in the UK, not just UK, but when you look across the globe, do you have a sense for how prevalent this disease is among the population?
So what we know is that the majority of valvular disease comes with people becoming older. So in nations and populations where people live to the 80s and 90s and even older than that, valve disease is a lot more frequent than nations that have a life expectancy of 40 to 45 years. And what we do see in clinic is when people develop symptoms, and usually when you have valve disease, you could get breathlessness, chest pain, blackouts. And once you have those symptoms, then you get picked up, you get followed in an intervention, either in the form of open heart surgery or minimally invasive surgery, or a percutaneous option can be considered. What we didn't really have a good understanding is how much prevalence of valvular heart disease exists in the community in people who do not have any symptoms. And that is exactly what our study focused about. So we invited 10,000 people from the United Kingdom, focused around three areas that represented the demographics of the United Kingdom at the time, and that was Birmingham, Aberdeen, and Norfolk. And of those people, just over half of them accepted to take part. And we identified that more than a quarter of them had some degree of valvular heart disease, which is a large proportion of patients. And these were patients over the age of 60.
And Professor, excuse me, how is there a rationale as to why? Is this disease genetic? Is it a mixture of genes and, for example, the lack of cardiovascular, exercise, bad nutrition, or is it a combination thereof?
Yes. So a very small proportion of valvular heart disease is down to genetics, but that we tend to see in children, in younger adults. When somebody has lived to the age of 60 without any concern about valvular heart disease, then we know that the influence of genetics is much less. What tends to be the main explanation why people get valvular heart disease as they become older is effectively equivalent to wear and tear of the valves that we get in other parts of the body. So what we have is an increased hemodynamic stress, that is, a lot more blood flows through the valves. The valves are being used significantly more if you live longer. And over the years, this leads to degeneration of the valves.
And Professor, you indicated that people that come into the clinic, talk about shortness of breath. Is there a way to detect this before you show symptoms? And I want to get the treatment in our second segment and prevention, but outside of someone presenting some of these symptoms, for example, can you look at a blood test? Like maybe not. Can you look at ultrasound or CAT scan or some MRI? You know, again, I'm not a practitioner, but is there a way to identify this ailment before it really becomes a problem?
Yes. So the most accurate way of finding out if any individual has a problem with one of the valves is to undertake an ultrasound of the heart, something that is called echocardiogram. And this is indeed what we did in the study. So we undertook an echocardiogram of people that otherwise would have had no indication for an echocardiogram. So if anybody had an indication for an echocardiogram, for example, if they were known to have valve disease or if they had any other cardiac condition that would have qualified them for an echocardiogram, they were not eligible for the study. The alternative is for either a family physician or a cardiologist to have a listen to the heart with the stethoscope. And although we know that that is good, it's not as accurate as when you undertake an echocardiogram.
Yeah. So it sounds like there's certainly things that I want to talk about this in the second segment. There's things that we can do from a practitioner's point of view to identify this ailment. Professor, as I said, I want to take a very quick break. When we come back, we're going to talk prevention and treatment. You're going to want to stay tuned right here on BRN AM. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device. Welcome back. We're joined this morning by Professor Vassiliou. He's a cardiologist with the University of East Anglia, Norwich Medical School in Britain. Vas, Professor, thank you so much for staying with us this morning.
It's a pleasure.
So I want to get to prevention in a second. Let's talk about treatment. Let's just say that you come in for shortness of breath, or you're fortunate enough to have an echocardiogram, or the doctor here, the professor or doctor takes a stethoscope and detects this. How can you treat it? Do you have to get a valve replacement? What do you do to deal with this?
So the first thing to say is that there are no tablets that can actually help, at the moment at least, slow down the progression of the valve disease or reverse the valve disease. And this is a question many patients have. Can we take something to stop it from getting worse? Can we take something to make it better? And the answer is no. So what we do at the moment is, once we know that somebody has any degree of valvular heart disease, we keep a close eye on them, and they get reviewed every 4 months, 6 months, or 12 months, or even a couple of years, depending on the severity of the valve disease they have. And that follow-up would include one of the cardiologists listening to their hearts and also undertaking an ultrasound of the heart, the echocardiogram. And what we look there is to see how has the heart valve disease progressed. Is this getting worse? We know that year on year it is getting worse, but the rate of progression is very different between individuals. And we also look for indirect effects of the valvular lesion on the heart, on the muscle of the heart. So if we find that the pumping action of the heart, for example, is being affected, then it suggests that we're reaching sort of the end of the road and we need to do something to the valve. Otherwise, there will be irreversible damage on the muscle of the heart. So if individuals have symptoms that we attribute to their valve disease, and they also have significant valve disease, severe valvular disease, then they would qualify for an intervention by both the European and American guidelines. In addition, however, in the guidelines, there are also certain pathways, whereby if you begin to see damage to the heart muscle, in other words, if the heart starts to get bigger, or if the heart starts to fail to pump efficiently, then those individuals can go ahead and have an intervention even if they have no symptoms. And that is why it is important to identify whether people have valvular disease or not, because there is an increasing step in providing earlier intervention before the valve disease causes any damages to the heart.
And just to follow that logic through, Professor, let's talk about prevention. So anyone watching this, maybe you're not yet into your 40s, 50s, 60s, and beyond. What can you do now as a younger person to, assuming you don't have any genetic predisposition to this, what can you do to prevent being afflicted with this disease?
So unfortunately, there is nothing anybody can do to prevent valvular heart disease. So it's purely a mechanical problem, effectively, of the valves opening and closing 70, 80, 90 times every minute, every hour of every day. And they get some damage because of that. But what individuals can do is to live a healthy lifestyle, ensure that they walk or exercise 3-4 times a week, have a healthy diet, avoid smoking, because if you were to have valve disease at some stage, it's very likely that you will require an intervention. And we know that even if you're 70 or 80 or 90, if you are a fit individual, the risk of that intervention will be much less. So healthy lifestyle would reduce the risk of coronary disease, but also make you more fit individual. So when the time for an intervention comes, you will be as good as you could before that intervention.
Last question, Professor. This is great research. How do you follow up on this research? What do you do next in order to tie it back and maybe gain more understanding, and also maybe more understanding of correction or treatment?
Yes, no, thank you very much for your kind words. So this is work that we have been doing over the last 10 years. And we have now moved on to the next phase, where we're using medication to try and see whether we can identify individuals with moderate disease, in other words, before they need intervention. And we're undertaking a randomized control study where we offer 50% of the individual the medication, and 50% we do not offer them the medication. And the medication we're using are a class of medication called SGLT2 inhibitors. And we're looking to see whether the SGLT2 inhibitors are influencing the degree of scar on the muscle of the heart that relates to the valve disease, but also whether it influences how quickly the rate of progression of valvular disease will be. At the moment, there has been no positive trial in any medication to try and influence the prognosis in patients with valvular heart disease. But on the basis of observational data we have, we believe that this particular class of medication may sort of reach the holy grail that we have been trying to find. So we are certainly all quite excited, and the specialists in valvular heart disease are quite excited. It's an issue of waiting for the study to complete, which we hope will do in the next 18 months. And I hope we can meet again and discuss that study in a couple of years.
Yeah, absolutely. Look, I'm not a scientist, but I know science takes time, and hopefully we can get to a point where we can get to prevention and also try to reverse some of the damage that may be done. Professor, we're going to have to leave it there. Great to see you. Thanks so much for joining us. And again, we look forward to having you back on the program again very soon.
Lovely. Thank you very much, and nice meeting you.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Then visit our website. Hey, we're back again tomorrow for another edition of BRN AM. We'll have a very special guest and another important topic. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.